Hi there, my name is Lori Chern from RN Collaborate. Today is November 13th, 2023. The RNC Restorative Health Program is developed to help you understand how to maximize your own unique and optimal level of health. This is the fourth of a 7-part series on restorative health. It'll focus on testosterone replacement for men. This entire presentation is based on numerous research studies and evidence-based practice with a list of approximately 50 references at the end of this presentation. This graph illustrates testosterone levels in men and how it declines as men age. Testosterone peaks in their 20s and declines to half of this level by the time they're 40 years old. Symptoms of low testosterone include reduced libido, sexual dysfunction, which includes erection not being as firm, and erectile dysfunction, decreased muscle mass and strength, increased body fat, lack of well-being, dysphoric mood, which include anxiety, irritability, and depression, poor sleep patterns or insomnia, lack of energy, decreased motivation or lack of enthusiasm, physical fatigue, changes in cognition, which include memory loss and poor concentration, reduced body hair, lack of well-being, and bone loss, which is a late presentation. Testosterone is a hormone that our body naturally produces. In men, a small portion of testosterone gets converted into estrogen, which is also essential. As such, some of this presentation will include the importance of this small amount of estrogen in men. Hormones are chemicals that are secreted from certain parts of our bodies that act on other parts of our bodies. They travel through our bloodstream, then attach to cell receptors, and then instruct that cell to perform a certain function within that tissue or organ. It is not normal to function without hormones. Evolution has not kept up with our longer lifespan as we live with significantly decreased levels of testosterone for decades. As of 100 years ago, our lifespan usually ended by the time we were 50. Men have testosterone and estrogen receptors in almost every cell in their body, which indicates that these two hormones have importance within almost every organ system in our bodies. The significant depletion of these hormones that occurs when men are approximately 45 to 50 years old has health implications that contribute to many of the chronic diseases that may ensue as men age. In this photo, estrogen and testosterone receptors are abundant in many areas of our brain. As we age, diminished testosterone and estrogen levels result in decreased metabolism in our brain. Reduced circulation of testosterone and estrogen result in decreased exerting effects on many brain areas that result in brain fog, disrupted sleep, dysphoric mood, which includes anxiety, irritability, and depression, decreased libido, decreased cognition, which are thinking processes, and memory impairment. There are estrogen and testosterone receptors in our blood vessels. Estrogen exerts its effect by inhibiting the ability of inflammatory cells and macrophages sticking to the inside walls of our blood vessels, also decreasing LDL cholesterol accumulation at these sites. Estrogen also improves healing and new vessel formation, and it also induces nitric oxide production, which relaxes and dilates the blood vessels to maintain optimal blood pressure. All of these contribute to atherosclerosis and cardiovascular disease. Testosterone exerts its effect by acting like a blood pressure medication, specifically like a calcium channel blocker, to relax the smooth muscle of our blood vessels and thereby maintaining optimal blood pressure. There is substantial evidence that testosterone is cardioprotective and that adequate levels decrease the risk of cardiovascular disease. Many research studies indicate that testosterone at physiological concentrations may have a beneficial effect on the prevention of thrombosis development, which is clot formation, also endothelial cell proliferation, which is the healing of blood vessels, and then it also has a beneficial effect to activate nitric oxide synthase, which is a blood vessel dilator to improve blood pressure. And there below is an example of an excellent academic journal, randomized controlled trials. Testosterone therapy increases muscle mass by increasing muscle protein synthesis. Both testosterone and estrogen will increase functional metabolism, improve insulin resistance, and help decrease the risk of metabolic disease, which includes type 2 diabetes and obesity, and decrease the risk of cardiovascular disease. Testosterone and estrogen protect our liver health and therefore our fat and cholesterol metabolism, and which greatly protect us against metabolic syndrome, which again includes obesity and type 2 diabetes, along with high blood pressure, and also cardiovascular disease, which includes atherosclerosis, heart attacks, and strokes. Testosterone and estrogen protect against inflammatory bone and joint inflammation, which both include rheumatoid and osteoarthritis, by preventing cartilage degradation and synovial inflammation. Testosterone and estrogen have anti-inflammatory effects on our nerves and brain neurons, which protect against fibromyalgia, neuropathy, and chronic pain syndrome. Many research studies have also identified that testosterone and estrogen are protective against demyelination and may rehabilitate demyelination, which has significant positive implications for people with multiple sclerosis. Through multiple complex pathways, testosterone and estrogen help regulate our immune response by modulating all levels of the innate and adaptive immune systems. Testosterone also has anti-inflammatory properties, which contribute to our immune health also. As noted in one of the first slides in this presentation, there are many testosterone and estrogen receptors in the brain. Neuroinflammation, which is inflammation of our brain cells, is the major mechanism involved in the pathology of Alzheimer's disease. Testosterone and estrogen decrease inflammation in the brain by 1, decreasing pro-inflammatory cytokines, 2, increasing anti-inflammatory cytokines, and 3, increasing nitric oxide synthase, which increases cerebral blood flow and perfusion, decreasing the rate of plaque formation, as you see in the third photo of this brain. Aging is characterized by systemic inflammation changes and organ dysfunction. Testosterone has anti-inflammatory properties. There are testosterone receptors throughout almost every cell and in every organ. Testosterone attaches to the cell receptors, enters the cell, and instructs that cell to perform a positive physiological function in order to maintain or improve the health and/or function of that cell or organ, and therefore contributing to our health as a whole. Because testosterone is anti-inflammatory, chronic pain may be improved with testosterone replacement therapy. Testosterone is anabolic, which means it builds us up. It builds our brains up, it builds our muscles up, it builds our stamina and energy up, it builds our libido or sexual desire up, it builds our sense of well-being up, and it builds our interest and pleasure of doing things up. Testosterone is a natural hormone in our body, and as Louise Newson, a physician in Europe, testifies that testosterone lights up our brains. Testosterone works on the brain and makes you want to do work, including physical, mental, emotional, and cognitive work. It improves our focus and concentration, our motivation, makes us want to exercise, and improves our sexual well-being. It is not normal to function with low testosterone and no estrogen. For 100 years and for thousands of years before that, humans typically did not survive past the age of 50, so extremely rare to live without testosterone and estrogen. Evolution has not kept up with our longer lifespan as we live without testosterone and estrogen for decades, which significantly contributes to our chronic diseases. Testosterone replacement therapy may decrease the risk of cardiovascular disease, which includes atherosclerosis, heart attacks, high blood pressure, and strokes. Will decrease the risk of sexual dysfunction, which includes libido and erectile dysfunction. Should decrease the risk of sleep disturbances and dysphoric mood, which includes anxiety, irritability, and depression. And decreased visceral fat decreases our risk of metabolic dysfunction, including diabetes and obesity. Decreases the risk of the complications related to long COVID and neurodegenerative diseases such as Alzheimer's disease, reduces our risk of cancer and bone fragility. Natural ways to increase testosterone in our foods is protein. The top 3 protein sources include grass-fed red meat, oysters and fatty fish, eggs, pomegranate, and leafy greens. We can increase our testosterone with vitamin D through either sunlight or supplementation, and exercise, both weight resistance training and aerobic exercise. Testosterone replacement therapy can come in the form of injections, which is the most common way. Can also come in a topical gel or injectable pellets. We do not ever prescribe oral pills for testosterone, as this is way too hard on the liver through that route. And the end, and thanks for watching. And the next 4 slides include all the references for this presentation.